Okay. So, what is your profession?
I'm a registered nurse in the CV ICU at Rogue Regional Medical Center.
And what hospital do you work at?
Asante, Rogue Regional.
Okay. What degrees do you have?
I have an associate's in an understudy in psychology, and then my bachelor's is in nursing.
Okay. How does working in the hospital affect you with your day-to-day life?
My day to day life, I would say working in the hospital can be very stressful and take a hard toll mentally and physically on a person's body. 12-hour shifts are very difficult. Fortunately, I only work 3 12-hour shifts, but it tends to impact my whole life, my family's life, my spouse's, and personal care becomes really important because I'm in nursing in a very difficult time to be in the profession.
Um, this is more about the wildfire smoke questions now. What health conditions do patients have when they come into the hospital for wildfire smoke related problems?
We see a lot of respiratory distress with wildfire. Unfortunately, with our elderly population, it particularly hits people hard. Um, the population that visits the hospital were daily smokers, a lot of them, and they've just aged to where at baseline they have COPD, emphysema, and it just really impacts their health when we have wildfire smoke to where they just come in respiratory distress in an emergent situation.
So it's kind of like people who have or do smoke. It's like they're already kind of weakened, and the wildfire smoke is easier to like attack like their bodies.
Exactly, right. So their lungs are already diminished. They already have a hard time. A lot of them are already on home oxygen. They already have a hard time taking deep breaths. A lot of them are already saturating like maybe 88, 89% on room air at home. Or they do have home oxygen, and then all of a sudden they can't breathe. They get shortness of breath. Some of them, even respiratory distress turns into like a cardiac respiratory arrest, turns into like a cardiac arrest situation with a lot of these folks who have very weakened lungs.
Okay. Is the incline of people coming into the hospital for wildfire smoke related health problems noticeable in the summertime?
Oh, absolutely. Um, that's when our emergency room is just brimming full of people in in some sort of distress related to wildfires. Not only that, we have a huge homeless population here who has nowhere else to go because they can't be on the street. They're in distress, and so they just come into the hospital knowing they're going to have clean air for possibly days waiting to see treatment, possibly, a full 24 hours before they get treatment. And they just kind of hang out in the lobby knowing they're going to get that clean filtered air to just provide some relief from the wildfire smoke.
Okay. Um, what is the most common health condition they see in the hospital that is related in some way to wildfire smoke?
Most common is respiratory distress. It's basically when, for some reason, you're at home, you're out shopping, and you suddenly feel like you can't catch your breath. Like you're very short of breath. People end up having like panic attacks or anxiety attacks, and it quickly develops into hypoxia, where your body and brain is starved of oxygen, and that leads to obviously a myriad of other problems. You end up with heart problems, um, just lung problems, lung disease. Your alveoli cannot fill with air, and you're not clearing that CO2. It's pretty a terrible feeling of starvation of air that we see a lot during wildfire season.
Okay. And this is the last question. Um, this is less specific to your profession. This is kind of just like just a question, I guess. What steps do you think we as a community or state can do to make wildfire smoke a thing of the past?
That's kind of a loaded question. I mean, there's always this joke about putting big wind turbines on the tops of the mountains to blow the smoke out, but that doesn't really fix the problem because this is just like a chronic issue west of the Rockies. I would just say more funding, to fight wildfires and not just let them blaze out of control and not call it just clearing of the land, and just be better at fighting it immediately and diverting resources, or having more resources, not only to maintaining our forests and our lands year round, but then if a wildfire strikes, really getting the resources out there to control it as best as possible.
All right, awesome. And yeah, that's the last one. Sick.